When the COVID-19 pandemic brought daily life to a screeching halt in 2020, uncertainty reigned on health systems across the world. With sobering lessons from the pandemic in hand, an inclusive and transparent global collaborative approach to pandemic readiness will prove critical in the wake of a global public health emergency. South Africa was among the countries that faced the brunt of the COVID-19 pandemic. Therefore, positioning at the front line of proactive, collaborative decision-making forums such as the 4th G20 Health Working Group meeting could yield positive outcomes for the country's national health security.
We need to have the pandemic agreement to actually address the inequities that we saw, where as low middle income countries we were at the far end in terms of access itself, the costs of the vaccines that were out there, vaccines, diagnostics, therapeutics. We were at the far end as low middle income countries. So the pandemic agreement is meant to exactly address this to make sure that we address issues of manufacturing, end-to-end capacity, building capacity of the more low middle income countries in terms of manufacturing the whole ecosystem, from end to end, the supply chain. And so, of course, financing is an important component of this. So this is why we need to, urge member states for domestic resources.
Ahead of this meeting, member states unanimously agreed to the establishment of the pandemic agreement. Spearheaded by the World Health Organization, it is a critical development set to pave the way forward for collective efforts in pandemic readiness.
Particularly looking at making sure that we are ready for the next pandemic. The COVID-19 clearly showed the gaps and the inequities that existed. And so the main focus is to say never again. How do we make sure that we are better prepared and also, in fact, also be prepared, respond and act as well. So the whole essence is to really discuss this.
Among the key priorities of the G20 Health Working Group is strengthening the health workforce. Healthcare workers remain a vital artery to health service delivery and improving population health outcomes. However, persisting challenges pose a threat to their sustainability in health systems across the continent.
To look at all of the funding opportunities available through things like the African Development Bank, the World Bank and other investment financing to make sure that we have the resources we need to achieve the aims and objectives that we have for improving healthcare. The health workforce is a big chunk of that. Across the continent, there are push and pull factors. One, we are not training enough. The numbers that we are training are leaving because of either work conditions or poorer remuneration. So these are areas that require urgent intervention. In addition to that, we do, of course, need to find incentives to the workforce that exists to make sure that we achieve more equitable distribution, because most healthcare workers are in cities or more developed parts of the country.
Strengthening health systems in a quest to achieve universal health coverage will require an effective and well-trained workforce whose work is informed by policy guidelines underpinned by science and innovation. This could see the existing barriers to increasing access to equitable quality healthcare as a thing of the past. Zandile Mieza, SABC News, Johannesburg.